the brain can affect a person's memory, emotions, or let's say behavior. Neuropsychology is a branch of psychology that studies the relationship between the brain and behavior. It helps us understand how different parts of the brain influences the way we think, feel, remember, and act, especially when the brain has been affected by injury or disease. What does a neuropsychologist do? A neuropsychologist assesses how well a person's brain is functioning by evaluating the skills such as memory, attention, language, and problem solving. They help identify cognitive difficulties caused by the brain conditions and work with other healthcare professionals to recommend appropriate treatment and rehabilitation plans. Neuropsychologists support people with all ages who are living with neurological conditions. They work with individuals who have experienced brain injuries or strokes, people with dementia or epilepsy, children and adults whose thinking, learning, or behavior has been affected by disorders of the brain. Neuropsychologists work in diversity of healthcare and educational settings. They include hospitals, rehabilitation centers, memory clinics, universities, research institutions, and private practice. In each setting, they help assess brain function and improve patients' quality of life. What conditions do they assess? Neuropsychologists assesses many different neurological conditions. These include traumatic brain injuries, stroke, dementia, Parkinson's disease, epilepsy, and memory disorders such as amnesia. Their assessments
How do
neuropsychologists
these
assess the brain affect thinking, behavior,
To understand how the
and
brain is
daily
working,
functioning.
neuropsychologists use a range of psychological assessments.
These include the test of memory, attention, language, reasoning, problem solving, and other cognitive abilities. The result helps identify strengths, difficulties, and areas that may benefit from treatment or rehabilitation. Being a neuropsychologist requires a combination of scientific knowledge and strong interpersonal skills. They need excellent observation, critical thinking, clear communication, empathy, and careful attention to details. These skills help them understand each person's unique challenges and provide effective support. To become a neuropsychologist, it begins with earning a degree in psychology. After that, specialized postgraduate training in neuropsychology is required, along with supervised clinical experience. Finally, professionals must meet the license or registration requirements of the country where they wish to practice. Why is neuropsychologist among the many other careers in psychology important? Neuropsychology plays an important role in healthcare because it helps identify cognitive problems that may not be immediately visible. It supports recovery after brain injuries, guides treatment planning, and helps improve the quality of life for people living with neurological conditions. In conclusion, neuropsychology helps us understand the powerful connection between the brain and behavior. By assessing and supporting people with neurological conditions, neuropsychologist helps improve thinking, memory, emotional well-being, and everyday functioning. Thank you for watching. If you enjoyed this video, don't forget to like, subscribe, and join me for more psychology topics.